I love babies.
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 I love babies.
I love babies. Mwah.
I'm Dr. Michelle Bennett. I was born in Topeka, Kansas, and I moved to Lawrence when I was 3. And I grew up in Lawrence, went to KU for undergrad, so I've been around for quite a while.
I'm Lou Ann Baumschen, and I work at Lawrence Memorial Hospital in the Family Birthing Unit.
I'm Tracy Hoopengarner. I'm the Director of Maternal, Child, and Peds here at LMH. Been a nurse for 27 years.
I'm Sarah Miners-Hagen. I had all 3 of my babies at LMH. My oldest, her name is Violet. She was born in March of 2008. Mia was born about a year and a half later, in July of 2009. And then Ruby was born in December of 2010. My experience at LMH in the family birthing unit has been wonderful. I love the fact that LMH is local. It's a community hospital. It's filled with people that are in the community that I see on a daily basis, that I can experience that moment, and that makes me really happy.
We average about 1,000 deliveries a year, and that can go up and down depending on the year, but that's about what we average. Lawrence Memorial Hospital has more of a community feel, and even though it's a community hospital, we still offer very great service. Our Family Birthing Center, I think, does a great job providing wonderful care to our patients.
The nursing staff is excellent. They're highly skilled, extremely knowledgeable about their profession, and obstetrics is a really highly, specialized area as far as nursing goes.
When a person comes in labor, the expectation is everything's going to be fine. Sometimes, unfortunately, it is not, so we have to have everything in place in case of that situation, and have the nursing staff and the physicians that have the skill to be able to do that.
The special care nursery in our Family Birthing Center has an average of 60 patients a year, and it's important to have that level of care here at Lawrence Memorial because those families aren't separated during that birth.
I've heard a lot of patients come away from their birthing experience just in awe of the labor and delivery staff as well. Not just the physicians, but also the nurses that they worked with, just feeling like they were really well cared for. It was their primary objective to be there for that family on that day and that moment, and that's such a special time in your life. You really want to feel like everyone around you is focused on that main objective, healthy mom, healthy baby, coming away with a good outcome.
The patients that we hear from are always very impressed by their physicians, how caring they are, and very competent. They really appreciate knowing their nurses out in the community when they see them. I think that's very important to them.
It's such a special time in a woman's life and in a family's life to have a baby, and it's really great to have a physician who is open to make that experience how you want to have it. I would absolutely tell anyone that I see in the community or outside the community to get their health care at LMH.
LMH has given a lot of things to labor and delivery that have helped to really make our goals become reality in terms of keeping families together and keeping babies who may need a little bit of extra attention at mom's bedside or close by. The Segerbrecht room has been a huge benefit for patients whose children need to stay in the nursery a little bit longer, get some extra attention. Similarly, the panda warmers that allow babies to be in the room with their assessments next to the mom immediately after delivery is really helpful because it keeps mom and baby close by even when baby might need a little bit more attention. So there are a lot of really good benefits that we've received from the Endowment Association that I think our patients directly benefit from.
The Endowment Association benefits the hospital in many ways, and for our unit and our patients, We see those effects every day, and I just can't imagine if we didn't have the Endowment Association.
LMH is part of our community, and technology is always changing. Medicine and Medicare is always changing. So there's always needs at a hospital or in a medical facility for new things. So if you are a grateful patient, if you had a great experience at LMH, give back. It's very important. We all are responsible for our community healthcare system, our community facility, our community hospital. It helps the greater good of the community.
I love
Lawrence Memorial Hospital.
I love Lawrence Memorial Hospital.
I love Lawrence Memorial Hospital.